So let's move forward and start with the gram-positive bacilli, which are the rest of them that we are left with. Corynebacterium, diphtheria, diphtheroids done. Nocardia, actinomyces, filamentous done. The beautiful story of Listeria monocytogenes done. So now we move on to the spore-forming organisms, and those include Bacillus anthracis and Clostridium. So Bacillus and Clostridium species we shall be doing. Obviously, my first emphasis will be on Bacillus species. Now please remember, when I said spore-forming organisms, Bacillus and Clostridium, one of them is said to be an obligate aerobe. So remember, Bacillus is an obligate aerobe. It is going to work on oxygen, and Clostridium is going to be an obligate anaerobe, right? Second point that you need to know is Bacillus, and both of them have spores, but they ask you which has bulging and which has non-bulging spores. So remember, B is not for B. When I say B, so Bacillus has bulging, no, B is not for B. Bacillus has non-bulging spores. Whereas on the other hand, Clostridium is going to have bulging spores. This is a very common question that you are asked, and many students are not even aware that what is the meaning of bulging or non-bulging. So for example, if this is your bacteria, this is one rod, gram-positive rod, and this is another one, you will have to see how is the spore located. If the spore is like this within the walls, within the cell wall, this means it is not bulging out. But if it is looking something like this, you see a part of it is bulging out, then it's a bulging spore. So that's the common sense. This happens to be a bulging spore, and this happens to be a non-bulging spore. You've understood the difference. You've also understood the example. B is not for B. So right now I'm starting with Bacillus. What are the points? Obligate aerobe, and B is not for B. So bulging nahi hai. This is a non-bulging spore. Remember, this is the most common lab contaminant that we have in the culture media, that is in a microbiome lab. And now we have lots of bacillus. We have Bacillus anthracis, we have Bacillus cereus, we have other bacilli which we might not study. But out of all the bacillus, please remember, all of them are motile. All of them are some common features. All the bacilli family, they're going to move around. All of them are going to break blood, and all of them are going to break the capsule. They are not encapsulated. So they're like big time breakers. What do I say? Bacilli are big time breakers. They are going to move around. They are not going to get limited by a capsule. They'll break the capsule unencapsulated. They're going to break the blood. However, to all of them, there is an exception known as Bacillus anthracis. Bacillus anthracis is the exception to all of these. That is what I wanted to tell all of you. So remember, this means Bacillus anthracis is non-motile, it is encapsulated, and it is non-hemolytic. It doesn't believe in the break thing. It is not going to break blood. It is not going to break the capsule. It is going to be within the capsule, and it is not going to move around. It is going to sit at one place. That is what Bacillus anthracis is. Baki sab ghumenge, they will break the blood, they will break the capsule. That is how you learn it. Okay, so let's start with that only. So you'll say, before this, ma'am, right now, till now, what all bacilli have you told me? Can you summarize for me? Bacillus anthracis and cereus, so I'm going to tell you in this chapter, right? But where have I taught you Bacillus stereothermophilus? If you remember, these set that you see over here, these are all controls which you've done in the sterilization disinfection chapter. Bacillus stereothermophilus was the control for two things. One is an autoclave, and the other is going to be a plasma sterilization. Bacillus subtilis is going to be the one for hot air oven. Bacillus pumilus, from P we had made an R, so that was the control for radiation. And Bacillus globigi, with G we had studied for G, gas sterilization. I've done a very rapid review of these. For the details, please go to the sterilization disinfection chapter, but you ultimately realize that all the spore forming organisms are being used as controls. Now in this chapter, my focus is anthracis and cereus, and let me start with Bacillus anthracis. Anthracis is said to be the first, like I told you, it's a bacteria of exceptions. It's going to pick up all the exceptions, and it's also going to be something special. It's the first to a lot of things. So please note, if they ask you which was the first organism that was seen, pathogenic organism seen under microscope, Bacillus anthracis. Which was the first pathogenic organism to have a live attenuated vaccine? Again, Bacillus anthracis. Which was the first to be isolated in culture media? Again, this one, which is the largest. Of first head, so it's given so much of priority, the largest pathogenic bacteria, again Bacillus anthracis, and of course deadly first bioterrorism category A bioterrorism agent. So like I said, it's bacteria of firsts and it's a bacteria of exceptions, right? So remember, first to be seen under microscope, first ka live vaccine, first ka isolation, largest and deadly category A bioterrorism agent. So let's begin. What are its virulence factors? As I told you, this is capsule, this is limited, this doesn't break anything. So this is not breaking the blood, non-hemolytic, this is not breaking the capsule, so it has a capsule. This is a capsulated organism, that is one thing. And of course, Bacillus anthracis will have the anthrax toxin. So my first thing is, who codes for it? So remember, there is something known as the PXO1 and PXO2. What are these? These are types of plasmids. PXO1 and O2. So remember, anthrax ka jo toxin hai, A is the first alphabet and capsule is going to be second, third alphabet na. So basically PXO2 capsule ke liye hota hai and PXO1 plasmid is for the anthrax. So this is basically plasmid coded. Both of these virulence factors are plasmid coded. So just imagine, if the plasmid is lost, what is going to happen? There is loss of virulence. This is not going to be virulent any longer, because if plasmid gone, then the capsule also gone, the toxin also gone. When do you want to use this, exploit this situation? I know that if I have to make a vaccine, I will have to remove the virulence factors. So what will I do? I will remove the plasmid and the virulence factors will be removed, and that is what is used in making a vaccine. This is a vaccine known as the Stern vaccine, which I'll be telling you in a while. Animals ko dete hain because Bacillus anthracis comes from animals, okay? So repeating, there are virulence factors, capsule, anthrax toxins, everything is under control of plasmid. Plasmid gaya, virulence gaya. Now let's go into details about capsule and toxin. Remember, the capsule is, everything is different. This is, I told you, this is the organism of exceptions, which means that all the capsules, what have you studied in your general microbiology? All the capsules are made up of polysaccharides. But what is Bacillus anthracis made up of? Bacillus anthracis is made up of polyglutamate, polypeptide. Polyglutamate, polypeptide. Basically, peptides ka hota hai. It isn't of polysaccharides. All other capsules are polysaccharides. What is different about the toxins? Till now, I have taught you all the toxins tend to have two parts. All the toxins tend to be bipartite, but now I'm going to tell you that the anthrax toxin is tripartite. This is the only toxin which has three parts, and that is English Premier League. What is English Premier League? Edema factor, protective factor, lethal factor. Edema factor means what is the mechanism of action? Edema matlab it is going to increase the cyclic AMP. You know, there are a lot of bacteria which increase cyclic AMP. Some increase cyclic AMP, some increase cyclic GMP. So after a while, when we've done more bacteria, I'll give you a list. Abhi ke liye learn, Bacillus anthracis is going to increase cyclic AMP and cause edema. Protective, how will it protect it? It helps in attachment of the bacteria. That is why it's protective. And how is it going to be lethal? Lethal factor, of course, will cause death of the cells. So as I said, English Premier League, edema factor, protective factor, lethal factor, and which cycle or channel is activated? Cyclic AMP is activated. So let's go on to the disease. How are we getting this disease, and what is actually the infective form? How are we getting it? So please note, this is a zoonotic disease, means it is gonna come from the animals to the humans. That is the concept of a zoonotic disease. So what comes to the humans? Does the full bacteria come to me? No. The infective form is the spore. See, it's a spore forming organism. So the infectious form is going to be the spore, and spores are always more deadly. How did it come into my system? Either it came in contact with my skin, or I ended up breathing it, or I ended up eating it. Teen forms possible. Either it is skin contact or inhalation or ingestion. Let's start one by one. When I talk about something known as cutaneous anthrax, you'll say, oh ma'am, this is because of skin contact, and that is known as Hyde-Potter's disease. Do you know the meaning of this word? Hyde. Hyde is what? Hyde refers to animal skin. Hyde is the other name for animal skin. And who is a porter? Guys, porter is a person who picks up very heavy things. Like you must have seen the coolies on the railway stations. So these are porters. They pick up very heavy things. So these are the porters who are going to pick up animal skin. So just imagine, for example, if this pencil of mine is big, heavy bundle of animal skin, I will never pick it up with one hand like this. I'm going to put it on my back. I'm going to put it on my neck and my shoulder. And that is how all the coolies also walk now. So where are they going to put their animal skin? The animal skin is coming in contact with their neck, with their shoulder. So where do you think the lesion is going to develop? Yes, this is referred to as a malignant eschar. First and foremost, look at the color of it. It is very, very black, and that black color, because it's looking it looks very scary, na, that black color. That is why we are calling it malignant. That is why we call it malignant. Otherwise, there's no malignancy as such in it, hai na? But we call it malignant because it is black in color. Okay, this is if the person had a skin contact with animals. If there is an inhalation, when would there be pulmonary anthrax? Someone working in the wool industry, wool sorter's disease. So wool fibers will be inhaled, na? So pulmonary anthrax is known as wool sorter's disease, and this results in hemorrhagic mediastinitis. This is very commonly associated with hemorrhagic mediastinitis. That is the most common thing to occur. Actually, earlier it used to be said that lungs affect होते हैं. Per se, the lungs are not affected. It's not the parenchyma of the lungs that is affected. It is the mediastinal part that is affected over here. So remember, mediastinitis. And from there, of course, we can have other complications. There can be pericarditis. There can be septicemia. So all other complications are definitely possible, but hemorrhagic mediastinitis. And this is the form that is associated with bioterrorism, because bioterrorism means you should be able to spread it very quickly. How will you be able to spread the disease very quickly? If the spores are inhaled by a lot of people. See, skin contact will never happen to all the people in a population. Eating also will never happen to all the people in a population, but breathing will happen to everyone. So the bioterrorism wala is definitely going to be the wool sorters, or you can say the pulmonary anthrax. Finally, if we eat undercooked meat, if there is consumption of undercooked meat, that is going to result in intestinal type of anthrax. So simple, like I told you, there is a cutaneous anthrax, which is the most common. What was the other name? That was the Hyde-Porter's disease. Then we can inhale it, and that is going to be the inhalation of wool. So that is going to be wool sorter's disease. And if we are going to eat it, that is referred to as intestinal anthrax. So you forgot to tell me what in the intestine. Diarrhea, virya, to theek hai. But in the intestine, there is going to be hemorrhagic enteritis. There is going to be hemorrhagic enteritis, and ultimately I realize everywhere hemorrhage is happening. In the skin also something black hemorrhagic is happening. In the pulmonary system also hemorrhagic mediastinitis is happening. In the intestine also hemorrhagic enteritis is happening. And if this ends up getting complicated, then the brain will get affected and the CSF will also get hemorrhagic. Ho gaya yaad? Everything about it is going to be hemorrhagic. Remember, the irony is itself, though it is not breaking. Remember, I told you it won't break the blood. It will not break the blood. But look at the amount of bleeding it is causing. It is causing hemorrhagic lesions, hemorrhagic mediastinitis, hemorrhagic enteritis, hemorrhagic CSF, but it will not break the blood. It is non-hemolytic on an agar. So on that note, let's start with the lab diagnosis only. When I say lab diagnosis, what specimen will you take? It is very, very obvious that depends on the kind of the disease. If the person has a cutaneous anthrax, or the person has intestinal anthrax or pulmonary anthrax, or there is maybe CNS involvement, so the sample will depend on the type of anthrax. Similarly, this is a zoonotic. You don't have to focus only on humans. You also have to focus on animals, because this is an animal and human disease. So if an animal has anthrax, rule number 1, never ever perform an autopsy. If at all you have to take something, take either one ear or a blood sample. That is all that you can do, and this has to be kept in biosafety cabinets 2 and 3. We will be studying BSL, biosafety levels, and bioterrorism agents. We'll make a chota sa list at the end. We just keep reading it. You know, this is a bioterrorism A agent. So this is definitely going to be tested in a BSL 2-3 cabinet. So never ever do autopsy. Never ever do the autopsy. You're going to take a blood sample or cut the ear. That's all that you do for animals. Now, when I come back to humans, whatever sample I got, what am I going to do? I'll see it under the microscope. What do I see under the microscope? This is a question that came in NEET and in FMG. These are gonna be these dabbas. They are dabbas. Can we all see? There are these box. Some people call it bamboo stick appearance. Please note, some people refer to it as a bamboo stick appearance, and some people call it a box car appearance. Bamboo stick and box car appearance, and inside it you can see one hole. Why is there a hole? Firstly, because this hole is a spore, and I have told you so many times in general micro that the spore is gram poor. It is not gonna pick up the gram stain. That is why it's looking all khali. All those empty areas are nothing but the spores, because for spores, remember, we have some other stain. Batao, spore ke liye what stain is there? The Schaffer and Fulton stain. S for S, I had told you. The Schaffer and Fulton stain is what we use for the spores, hai na? So remember, that is going to be spore wala stain. Okay, so gram is not going to be useful over here. Bamboo stick I have seen. Now can I do something? There is a very famous reaction known as the Mcfadyen reaction. What is the Mcfadyen reaction? I will take this smear, whatever Bacillus anthracis ka smear is there, and I am going to add polychrome methylene blue. I will add polychrome methylene blue, because on adding polychrome methylene blue, I will realize that there is some purple material that is going to be noted. There is some purple material noted around the organism. That is going to be the capsular material. Around the organism, if you start seeing some purple material, matlab capsule hai. That is only seen if the capsule is present. So that is known as Mecphidian. The simple question comes, Mecphidian, kaun sa stain use karega? So you will say M for methylene blue, M for Mecphidian. So the polychrome methylene blue is used as Mecphidian stain, and this is going to be indicative of the capsule. So one picture is done. Let me, before I start off on this journey, this is the final flowchart we are going to come down to. So every picture one by one I'm showing you. First I have shown you this one. The boxcar appearance is done. Now let's go on to the different agar morphologies. How are the different agars seen? So let's begin. Please note that it can show you multiple appearances. Look at this one. The first one, does it look like that frosted glass? You must have seen frosting on the glass during rainy season and cold weather. So that frosted glass, number one. Okay, so just imagine yourself living the best life. The best life is what? If you have a car, if you have the open sky, and if you have good food, you're living the best life. So if you have a car on which there is frosted glasses, through those frosted glasses in the rainy season, you are seeing something that's comets. You can see comets in the sky. Can you see all of them are leaving a tail behind? This entire thing, everywhere you're seeing a tail left behind, like a comet tail. This is said to be the comet tail appearance. So that is the second good life. You have a frosted glass of your car. Through that, you're looking at the comet tail, and you have some amazing food in hand. That is a beaten egg. Not that amazing as a food item, but yaad kar lo, beaten egg appearance. So remember, the best of food being put together, the best of life being put together through a frosted glass. You're looking at the comets, eating good food, and that is what Bacillus anthracis is doing. And you know what I can do further? If I tend to look into, if I like, I can't zoom in, I'm not a microscope here, but if I take a hand lens and I go very, very close to this edge will show me some filamentous structures like this, and that is referred to as the medusa head appearance. So please remember, at the edge of the colony, we can see medusa head appearance. You will say, ma'am, why didn't you show me a picture of medusa head appearance? Because karega kaun? I am saying this is a bioterrorism A agent. Stay as away as possible from it. Why will you take a hand lens and go and put your head into it? You're not going to do that. No one does this. This is more for bookish information. Okay, so it shows you the medusa head. If you still want to see a picture, I've got you the picture. So what is this? Frosted glass. This is that comet tail. This is the beaten egg, and I've given you a pictorial representation that it's going to show you that all that medusa head wala appearance. Let's move on. Which other culture can you do? Now it's time for the next one. So you'll say, same to hai ma'am, ye sab bhi blood agar tha. Ye wala bhi blood agar hai, but there's a difference. To that blood agar, I have added penicillin. Look at the mnemonic. If I add penicillin, listen to me carefully. If I add penicillin, I am going to get the pearls appearance, the string of pearls appearance. Basically, on adding penicillin, the cells become goal, and that is why the capsule wala cells are becoming goal. Can you see? It's looking like a beautiful pearl string, the pearl string that women wear. So remember, if you have PE for pearls, this means you have used PE for penicillin agar. That is how I have learnt it. So ye bhi ho gaya. Moving on to the next. What if I use gelatin? So now tell me one thing before I start. Firstly, this is a tube and I have taken gelatin inside it. Okay, this has gelatin. And tell me one thing, when I'm dealing with Bacillus anthracis or I'm dealing with any bacillus, did I tell you that they will definitely require oxygen? They are going to be obligate aerobes. They are going to be obligate aerobes, means they are going to require a lot of oxygen. Wherever you give them oxygen, they will work. You don't give them oxygen, they will not work. So tell me, at the surface of the tube, there is a lot of oxygen, of course. At the bottom of the tube, there is not much oxygen, of course, again. So tell me, where is this? If I put bacillus inside it, where will it work a lot? Where will it have maximum energy to work? At the surface. So where has it broken the gelatin maximally? Gelatin maximally has been broken at the surface. As you are going down, oxygen come ho raha hai, the gelatin is also being broken less. So can I say the gelatin liquefaction is gonna occur maximally at the surface. It's gonna occur maximally at the surface, and then it is gonna keep on diminishing. What appearance have I got? This is referred to as the inverted fir tree appearance. This is referred to as the inverted fir tree appearance, right? So repeating once again, guys, now your final, almost you've come to the end. What was this? This was the boxcar or bamboo stick. Then you have the frosted glass appearance, the comet tail appearance, the beaten egg appearance, all of them show medusa head colonies, string of pearls appearance on penicillin agar, and gelatin stab is definitely going to show you the inverted fir tree. Full collage done, but there is a picture which you have to know, which you don't get a picture on, but definitely what is the selective media, the plet. Just listen to the name once. It's not something that is going to be asked, but sun lo ek bar. What is plet media? It is going to be polymyxin, lysozyme, EDTA, thallus acetate. Do you want to learn it? I think no. Polymyxin, lysozyme, EDTA, thallus acetate. Why am I telling you this name is just in case it is written like this in the exam. Don't feel that ma'am kabhi padhaya nahi tha, we have not studied it. No. So remember, PLET, plet media is the selective media for Bacillus anthracis. The story is not over. Is there any immunology that you will do? Yes, for antibodies you will do the Ascoli's ring thermoprecipitant test, which no one does, and we have the ELISA, which everyone does. Yes, for serology, this was an old test, thermo ring precipitant test. It's a simple way of learning that Ascoli's ring precipitant test. Firstly, if someone asks you what kind of a reaction is it, you will say immunology made it a precipitation reaction. And Ascoli will tell you that it is going to be present in anthrax. So, ye anthrax ka test hai. But nowadays everyone does ELISA. Are you ready with it? So now you understood with all of this that agent so dangerous hai, quite a dangerous agent. I need all my precautions with it. So the CDC guidelines have given a rule that, you know, till the time all these reports come, jab tak ye pura profile ready hoga, it is gonna take time. You don't have time. So what is the presumptive diagnosis of anthrax that I will take? If I have, is it a gram-positive bacillus? Yes. And I told you, na, it will not break anything. It is not gonna be hemolytic. I know that. It is not gonna move around. I know that. And we know it is catalase positive. Arey, ma'am, where did this come from? Go back to your first chapter, Staphylococcus. Catalase positive organisms ka mnemonic batao. Bubbly cats, space being made. Space being made. What was B? Bacillus anthracis. Hai na? So now things are falling in place finally. So remember, if you have an organism which is a gram-positive bacillus and catalase positive with no motility and no hemolysis, they are saying give a presumptive diagnosis of anthrax, consider it as anthrax for all practical purposes, and then do what? What precautions will you take? Number one, you have to make sure that if you are dealing with an animal, the entire factory has to be sanitized. If the animal is died of anthrax, make sure there is no autopsy that is performed, and you have to do deep burial. You have to do deep burial in quicklime. Always make sure, because you don't even want the environment to get contaminated. So there is going to be deep burial that will happen. Also, because I just told you people working in the wool industry, this is a question. Dekho, wo biosafety to I told you for your knowledge that sanitizing the factory and all is important. But question kya aega? What is duckering? Now we all know people working in the wool industry are at a risk of this disease. So you will have to disinfect the wool. How do you disinfect wool? It is done by formaldehyde, and when you go to your sterilization disinfection chapter, I have taught you over there that duckering is done. One of the uses of formaldehyde is that it is used for the disinfection of wool, and disinfection of wool is known as duckering. This process, this is where a question shall come to you guys. Remember, 2% formaldehyde is used. Now tell me, how are you going to do the treatment and what is the vaccine status? So let's start with the vaccine, because that is always more important. Now see, immunization दो लोगों का होगा. एक तो humans का होगा, of course, the vets, veterinary, because they can have pre-exposure prophylaxis, post-exposure prophylaxis, and secondly, the immunization of the animals is also going to happen. What happens in the humans is known as by the name only you will be able to guess, guys. That is known as Ava biothrax. So Ava biothrax tells me it is anthrax ka vaccine, but it is the humans wala anthrax vaccine, and it is the anthrax vaccine adsorbed. Okay, so this is what you have to learn. Anthrax vaccine adsorbed, that is what is Ava, and biothrax will tell you that haan, ye anthrax ka vaccine hai. Perfect. This is the humans one which is given to the vets, the veterinary and the professionals. What is given to animals? PSM is given to animals. PSM matlab Pasteur's vaccine, Stern's vaccine, and Mezuchi's vaccine, because PSM is very much interested in the community ना, community medicine है, तो community के animals के लिए हम PSM vaccine दे सकते हैं, Pasteur's vaccine, Stern vaccine and Mezuchi's vaccine. If you want to learn Pasteur, if you remember Louis Pasteur, I've given you the first slide of micro, gives me nostalgia that we started from there. The first slide of micro, I've told you that Pasteur gave us the CAR vaccines, that is the anthrax vaccine. Then Stern vaccine, S for S, it utilizes the spores. And Mezuchi, zoo, the Mezuchi mein Carbazoo strain is used. So please remember, Stern is going to be with spores and Mezuchi's vaccine is going to be Carbazoo strain. So PSM, Pasteur, Stern and Mezuchi are animal wala, community ke animal wala vaccine. And Ava Biothrax is going to be for our veterinary doctors. What is the treatment? The treatment protocol in uncomplicated cases, just skin, uncomplicated is different. Whereas if there is complications and there is CNS involvement, the treatment is different. So kya hota hai? Overall, the treatment is ciprofloxacin or doxycycline for 7 to 10 days. That is what you do. Okay? But if it starts getting systemic, systems are involved, if CNS is involved, things are getting complicated, then you have to go in for something extra. You have to go in for a 60-day antibiotic, which is not just going to include ciprofloxacin. No, it is also going to include meropenem and clindamycin. Then you have to go in for a 3-thing for 60 days. That is what I'm saying. Ciprofloxacin, meropenem and clindamycin for 60 days. And on top of that, guys, you also have to add an antitoxin. Now we have an antitoxin also that is available. We have a monoclonal antibody available, and if you read it, it sounds something like Bacillus anthrax. So if you read it, Raxibacumab, mab to matlab monoclonal antibody, and Raxibacu, bacu will tell you Bacillus, Raxi matlab anthrax, है ना? तो Bacumab anthrax, that is how you combine it. So Bacu, Bacillus, Raxi is going to be monoclonal antibody which you can use. So that depends. अगर uncomplicated है तो सिर्फ one drug for 10 days, ciprofloxacin or doxycycline for 10 days. But if it involves any systems, then it is ciprofloxacin with meropenem with clindamycin for 60 days, and you can add an antitoxin too. And the same thing you do for veterinary doctors, because this could be a situation you'll get very commonly in life. You could have a veterinary doctor coming to you with post-exposure prophylaxis. What will you do? You will not only give that CMC ka 60-day combination, you will also have to give that veterinary doctor a vaccine. So both the things have to be done in order to protect him from anthrax. Okay. Now going forward, Bacillus anthracis is done. We are ready with Bacillus cereus. Bacillus cereus, S for S, it is a natural inhabitant of the soil. And Bacillus cereus causes food poisoning. Simple way mein baat kare, to Bacillus cereus causes food poisoning. So now you will tell me food poisoning is of two types. Either you vomit it out or you poop it out. Basically, either there is vomit it out emetic type, or there is a lot of diarrhea, so diarrheal type. Okay, first I'll want to know that which of them has what incubation period. So emetic, simple, you eat food from your stomach, coming out in the vomiting is going to be a shorter path, coming all the way through the intestine into your poop is going to be a longer path. So incubation period of the vomiting is going to be smaller, less than 6 hours. Whereas for diarrheal type, coming out all the way in the stool is going to be problematic. So 8 to 16 hours. Okay, so less than 6 hours and 8 to 16 hours. Then we had also studied that less than 6 hours wala kaun sa hota hai? If you remember, Bacillus cereus, which has an incubation period of less than 6 hours, was very commonly confused with Staphylococcus aureus, if you remember, hai na? But the difference was that Bacillus cereus was because of the consumption of Chinese fried rice, and Staph aureus was that milk and poultry. Remember, milk and meat. So I hope you all remember that from your first chapter. So Bacillus cereus, which is going to result in vomiting, is going to be Chinese fried rice, whereas diarrheal type, which is taking too much of time, 8 to 16 hours, is going to be by milk and meat. Next, now this is Chinese fried rice. So you fried and you made Chinese food and you heated it, but still the toxin could work. This means it is heat stable. Whereas diarrheal type is going to be heat labile. Now coming to what is the mechanism. One of them increases cyclic GMP, one of them increases cyclic AMP. How did I learn it was, see, emesis, vomiting. Vomiting kahan se hota hai? Gale se hota hai. Vomiting is going to happen from the gala, whereas diarrhea is going to happen from the anal canal. So diarrhea is through anal canal, therefore cyclic AMP. And vomiting is through gala, so that is going to be cyclic GMP. That is just a way of learning it, okay? So emetic type is through the gala, cyclic GMP. Diarrheal type is through the anal canal, so cyclic AMP. But what toxins am I talking about? Please remember the diarrheal type is going to be the NHE toxin, which is responsible for which kind of diarrhea? It is responsible for the secretory diarrhea. Whereas when I'm talking about the emetic type, we are talking about a product called cerulide. We are talking about cerulide, and you know what cerulide has? It has a vagomimetic action. Ma'am, ye wala word I have read somewhere else also. Earlier when we were doing Staphylococcus aureus, that was also having a vagomimetic action. Now I can analyze. Staph aureus also stimulates the vagus and results in vomiting. Bacillus cereus also results in vagomimetic action and results in vomiting. And that is why in dono ka incubation period is less than 6 hours. Dono mein, whether it is Staph aureus or it is Bacillus cereus, it's the vagus that is stimulated and the incubation period is less than 6 hours. I hope everyone's okay with this. Let's do a very quick recap before we go on to the last slide. Look, listen. Emetic, shorter route, shorter incubation period. It is by C for C, Chinese fried rice, fried it, heated it, and still it happened. This means it is heat stable. And gale se aa raha hai, to cyclic GMP. It is because of vagomimetic action, very similar to Staph aureus. Diarrhea, more time for stool to come out. So incubation period 8 to 16 hours. It is going to be because of milk and meat. It is basically heat labile, and it is coming through anal canal, the cyclic AMP, and the name of the toxin is NH. Coming to the last part, what is the diagnosis? Now, I had already told you, every bacillus, but anthrax was the exception. Na? Every bacillus is gonna break through things. It's gonna roam around. It's gonna be motile. It's gonna break blood. So this means it's gonna be hemolytic. It is gonna break the capsule. This means it is non-encapsulated. It all breaks. Everyone breaks. Anthrax doesn't break. But what is the selective media? MIPA and PEMBA are going to be the selective media. Okay, this is something which one day I was reading through it, and because I was trying to, I was again and again saying these words in my mind, MIPA, PEMBA, because I wanted to make a mnemonic for all of you. And I said, how should I make them learn that Bacillus cereus is going to have MIPA, PEMBA in it? And suddenly I got reminded of I think 2 years ago this happened. I got reminded of a very famous clip that went viral over social media and all news channels also, when Mamata Banerjee gave a, there was a clip where there were some words which were used, that is rumba. If you remember, there was a speech of hers where she said this, and then I realized that Bacillus sounds by her name, Banerjee. So she was very serious in that speech. She was addressing a very big crowd. It was one of her hometowns, and that was a very serious speech by Mamata Banerjee ma'am, and that was MIPA PEMBA. So that what she spoke in that speech was rumba, if you remember. So yeah, MIPA PEMBA for Banerjee wala speech. For Banerjee wala serious wala speech, it is going to be MIPA PEMBA. What is MIPA PEMBA? That is mannitol. That is going to be mannitol, then yolk, polymyxin, agar. Mannitol, yolk, polymyxin, agar. And PEMBA is again going to be something very similar. Again, it's going to be polymyxin with mannitol, bromothymol blue, agar. Of course, there's another long full form to it. I don't want you to get into it. MIPA PEMBA bhi yaad karo with polymyxin present in both. I think that much of it is good enough. So MIPA PEMBA in that speech that you will remember, that is Bacillus cereus. I hope everyone's okay with this because we have wrapped it up. Ready for some MCQs? Let's start. Which of the following is not a virulence factor for Bacillus anthracis? Not. तो Bacillus anthracis के लिए capsule था. Capsule is written. Bacillus anthracis के लिए capsular polypeptide it is. But regarding the toxin, it was English Premier League. Edema factor, yes. Protective factor, not written. Lethal, death wala. Lethal to hai. Labile is nothing. This is apna banaya hua. This is nothing. Okay, let's move on forward. All of the following are characteristics of Bacillus anthracis, except, remember, Bacillus anthracis was something which said that, acha, let everyone break. I am not going to break. So tell me. First, tell me, does it have a poly-D-glutamic acid capsule? Yes. Is it non-hemolytic? It says, I will not break the blood. Yes, it is non-hemolytic. Correct. Does it have medusa head colonies? Correct. Is it motile? Does it break and run off? No, it doesn't break anything. It is non-motile, ma'am. It is non-motile. That was the rule. So which of the following is the wrong statement over here? The first one. Next, all are true about Bacillus anthracis except, is it non-motile? हाँ ये तो ठीक है, it is not gonna run away. Is it arranged in chains? Not exactly chains, but bamboo stick and boxcar बोल सकते हो. Let's consider कि हाँ ठीक है, अभी के लिए ठीक है. Tell me, does it have a capsule? It has a very famous capsule, correct? Does it have bulging spores? Does B and B go together? No, B is not for B. This is non-bulging spores. So this is definitely the wrong statement over here. Next, which of the following is not a cultural characteristic of Bacillus anthracis? Tell me, medusa head appearance दिखता है, string of pearls appearance, PE for pearls, PE for penicillin होता है, inverted fir tree appearance is seen on gelatin, बिल्कुल होता है. Ma'am, bamboo stick appearance is also seen in Bacillus anthracis, तो सब कुछ होता है. But they had asked you which is not a cultural characteristic. Bamboo stick appearance is a microscopy gram stain feature. It is a feature, but it is a gram stain feature. It is not a cultural characteristic. So that becomes the answer over here. Let's pick up one last question, guys. There is a food poisoning that has occurred due to ingestion of contaminated fried rice, Chinese fried rice. And what is the organism coming to my mind? Bacillus cereus. Which kind of Bacillus cereus food poisoning will occur? It is the emetic type, and that is going to be less than 6 hours as the incubation period. I hope everyone sorted because we have wrapped up all the bacilli. This means our one set of spore-forming organisms are done, and we are now going to move on to the second list, and that is the Clostridium species. Having discussed the bacilli, let's go on and now talk about the other spore-forming bacteria, and that is Clostridium. Now, under Clostridium, you know we are going to have Clostridium perfringens, tetni, botulinum, lots of those. But before starting with them, what did we talk about? What kind of an organism is it? Spore-forming organism. And if I ask you about Clostridium, I hope you know B was not for B. So Bacillus was not the bulging spore. Clostridium is the bulging spore. I've got a lot of bulging spores over here, but now I'm going to ask you the location. So please remember, the most common location of a spore is the subterminal, right? Subterminal location. So for example, Clostridium perfringens, what kind of a spore? Subterminal formation of spore. Okay, however, if I say that when does spore become terminal, when is it present right at the end of the bacteria? So you'll say TE for terminal, TE for Clostridium tetni, so TE over there, and TE for Clostridium tertium, so TE over there. So repeating, we have TE for terminal, TE for tetni, TE for tertium, and you can see that over here. You can see this is terminal and oval, this is terminal and round. Yes, terminal and oval, terminal and round, because this is terminal and round, so it looks like a drumstick. Tetni is going to look like a drumstick, whereas tertium is going to be oval spore, so that is going to look like a tennis racket. Many students get confused in the exam which is drumstick and which is tennis racket. So again, tertium is TER, tertium is TER, which is TE for tennis and racket. TER for tennis racket. So tertium is tennis racket and tetni is drumstick, but both have TE, so both are terminal. What are we left with? We are left with which of the spores are going to be right in the center. So you can see the spore is right in the center. That is Clostridium bifermentans. So bifermentans is anyway telling you that, okay, it's divided it into two parts. It has divided the bacteria into two parts. So Clostridium bifermentans, in fact, one Bacillus cereus can also result in a CE for central spore, right? So now if I ask you guys over here that which is the most common location of a spore, the most common location is going to be subterminal. But if I say where do you see TE terminal, you will say TE tetni, TE tertium. Which out of them is tennis racket? Tertium is going to be tennis racket. Like I said, tertium is tennis racket and tetni is going to be drumstick. What is the location of the spore in bifermentans? By dividing it into two, so the location is going to be central. All of this is done. Now let's move on to the different types of Clostridium. Now tell me common features. Is this a gram-positive bacilli? Yes. Can this have a B? Correct. These are going to have bulging spores. And I also told you it's an obligate anaerobe. All this I taught you in the previous Bacillus wala chapter only. Now I'll tell you something extra. Please note that mostly they are unencapsulated. Mostly these do not have a capsule. However, PCB. What? Physics, chemistry, bio. So, physics, chemistry, bio. Why did you take, let me ask you one. Why did you take physics, chemistry, bio? Which is the exam that you wanted to crack? You wanted to crack the PMT exam. These are your two mnemonics. So, I took physics, chemistry, bio for PMT exam. So, PCB. PCB का क्या मतलब हुआ? That when you are dealing with Clostridium P for perfringens, and you're dealing with Clostridium butyricum. These are the ones which are gonna have a capsule. They are gonna contain a capsule. So capsule is present. Remember, all the Clostridia are unencapsulated, but perfringens and butyricum is gonna be capsulated. Similarly, all of them are going to be motile. All the Clostridia are motile. But देखो PCB क्यों लिया था? Which is the exam that you wanted to kill or you wanted to crack? PMT kill करा था. So now I'm asking you kill. मतलब which of them are non-motile? Again, the P over here stands for Clostridium perfringens and T stands for Clostridium tetani type 6. So simple. Let's do a very quick recap. You have two things. One is PCB. So which are the capsulated ones? Perfringens and butyricum. Which exam did you want to kill? I wanted to kill PMT. So non-motile कौन है? Perfringens and tetani 6. This is also done. Now we can go on to this exception because perfringens is coming as an exception everywhere. Now tell me, what is it with capsule? Yes, perfringens has a capsule. Is it motile? No, it's not motile. So now we come to Clostridium perfringens, which was earlier known as Clostridium welchi. Let's begin with that. So like I told you, it is non-motile and it has a capsule and it is a gram-positive bacilli. And I've told you the most common location is subterminal spores. So now you realize if you've done the PCB, PMT and spores wala topic, now you don't have to do for every organism separately. Now you know which one is coming under which category. So now let's know basic. If I give you, this is that gas gangrene wala story that I'm starting with. Perfringens causes gas gangrene. So here we have the virulence factors. There are lots of virulence factors. Some of them are major, some of them are minor, some of them are just enzymes that you have. So repeating, the major ones yaad kar lo. Alpha, beta, epsilon, iota. What did I say? Alpha, beta, epsilon, iota. These are going to be the major ones. And after that, all the alphabets that you know. Gamma, delta, kappa, lambda, theta, eta, mu, nu, whatever ones you know. So kappa, lambda, delta, theta, eta, mu, nu, all of these come under minor. And what are the enzymes? Histaminase, neuraminidase. These are all coming under the minor wala enzymes that are there. Okay. Out of all of these, 4 major to ho gaya, but the one that I want you to learn is alpha. Alpha is going to have a lot of properties. Alpha is also known as lecithinase and phospholipase C. So, ye lecithinase kahan use hoga? That you will come to know in 10 minutes. Okay? But just remember that the alpha, major alpha one is going to have a lecithinase activity. These are the virulence factors. What is the disease that it's causing? Of course, this is going to occur because of a wound infection. So most of the times there is some road traffic accident, some crushing injury, some kind of wound infection that has occurred. Because of it, starting with it is just any like simple wound contamination can occur. But in advanced cases, it can result in anaerobic cellulitis and it can result in the most deadly gas gangrene. What is gas gangrene? It is said to be, why am I using the word anaerobic everywhere? Because Clostridium by definition is anaerobic. And myositis, because gas gangrene is a type of and myonecrosis. It is a type of a myonecrosis. So how is the muscle dying? How is that crushing injury, whatever injury we had, how is it making the muscle die? And that is what I'm going to tell you. So firstly, if you want this organism to work, if you want Clostridium perfringens to work, number one, every Clostridium requires anaerobic. You need anaerobic environment. Secondly, the wound has to be contaminated. Very rarely will it occur spontaneously. Most of the time there is some road traffic accident, some crushing injury, some trauma, aisa kuch history hoga. So that number one, there is some contamination that happens. Okay, now let's start from here. If a contamination has happened, chalo, there was a road traffic accident and the wound has occurred and the wound has been contaminated with a Clostridium perfringens. I told you Clostridium perfringens has a very important toxin called alpha toxin. Alpha toxin has lecithinase activity. So what is that lecithin going to do? Lecithin is going to damage the cell membrane. Lecithin, wherever lecithin is present, it will damage it. Means the blood vessels are damaged. The capillary permeability will increase. All the fluid will come out of the capillaries. If these were the capillaries, I'm saying that all the fluid is basically going to come out. All the fluid will come out. This means now the muscles are tense that, oh, this muscle was sitting over here. But now there is so much of fluid that is coming. So it's creating a lot of pressure on that muscle. There's a lot of tension in this muscle that is created. Matlab muscle goes into further anoxia, further oxygen will go down, further anaerobiosis hoga. So this entire cycle is then going to become vicious. More the oxygen goes down, more happy the perfringens is that, I wanted anaerobic environment and so I have got it. Meanwhile, this alpha toxin is also going to do something very important, and that is it is hemolytic. It starts breaking the red blood cells, and hemolysis hoga, so all the hemoglobin will start coming out into the urine. These patients also have hemoglobinuria. So please remember, number one, there is going to be a lot of tension on the muscle. That is also done by alpha toxin, and similarly alpha toxin can also cause hemolysis over here. तो कैसा दिखेगा? How is the gas gangrene going to look like? So firstly, when we are talking about any kind of gangrene, we know for a fact that there is a lot of foul smelling, blackish, very dirty looking tissue that is there, because this is nothing but a case of myonecrosis. So what is the patient going to be? The patient is going to be in a lot of pain. There will be some discharge, as you can see, that is coming out. But gas gangrene means that there are gas bubbles that have formed. How will I get to know? There will be that cut wala sound. That cut sound is nothing but crepitus. Crepitus is going to be there, and that is something which will distinguish this gangrene from all the other gangrenes. There's going to be crepitus, and in, of course, some patients there can be shock as well. So now my question to you is, you've understood gas gangrene is caused by Clostridium perfringens, but is Clostridium perfringens the only organism that causes gas gangrene? No. Remember, gas gangrene is caused by PSN, not PSM. It is PSN. Okay, gas gangrene is going to be caused by PSN. P for perfringens, we know. Septicum and novi. Perfringen, septicum, novi. Why have I said that you have to learn it as PSN? Because you will see that the incubation periods are increasing. Perfringens ka incubation period is less than 2 days. Then it is going to be 2 to 3 days, and 3 ka double, the next one is going to be 6 days. Simple. So less than 2 days, then we have 2 to 3 days, and then roughly up till you can say 6 to 5 to 6 days, that is going to be perfringen, septicum and novi. All of these three are capable of causing gas gangrene. Okay, so now you will obviously ask me the next question, कि gas gangrene हो गया ma'am, this is how my patient is looking like. Can you tell me the treatment part of it? Of course. What are you going to do? First and foremost, you need to understand there's a lot of dead, look at this, there's a lot of dead muscle, dead stuff here, debridement. Surgically, you will have to remove it. So the first thing will always be surgical debridement. After that, you will have to give patient antibiotics. So there is IV penicillin plus clindamycin, which is started for almost 2 weeks, 10 to 14 days, right? So there is going to be surgical removal. Then you're going to give IV penicillin. Then you also have to think of something, that this gas gangrene had happened because of anaerobic environment. So don't maintain anaerobiosis, give oxygen. You also have to consider hyperbaric oxygen. So surgery with hyperbaric oxygen, with IV antibiotics, penicillin and clindamycin, that is your treatment. And in some cases, you can also give the anti-gangrene serum. That can also be given. That may or may not be given, but passive immunization can be given in many of the cases. So you will say that, ma'am, in this you've not told us any diagnosis. You give the clinical disease, you give the treatment. Diagnosis kahan gaya? Because the clinical is not over. If you feel that Clostridium perfringens only causes gas gangrene, you are mistaken. Clostridium perfringens causes a lot of other things also. Number two, it can cause food poisoning because it has got some heat resistant spores. So it is basically because of some warmed up or cold meat, basically heat resistant spores hote hain, to food poisoning ho sakta hai. And because I'm talking about intestine, this can also cause gangrenous appendicitis. This can also cause necrotizing enteritis. Please note, and I've written some types which causes, which is not very important for you to know. If you wish to know, you can learn that gangrenous appendicitis is usually caused by the type A form, A for A, and necrotizing enteritis. Enteritis means colon. So colon wala is caused by type C. So remember, appendix wala is caused by type A and colon wala is going to be caused by type C. But as I said, not very important. Remember, these are some of the intestinal manifestations, and this is a PYQ. Necrotizing enteritis is caused by which of the following Clostridium species? So perfringens is not just gas gangrene, but a lot of food poisoning. In fact, I'm going to tell you one very interesting food poisoning. Uska naam hai pig bell. Pig bell is something which is not very common in India, but very common in European countries. And what is pig bell? So pig only tells me that, okay, yeah, there's going to be a pig involved. So there's going to be pork and potato. Pork and potato. So pork consumed along with sweet potato can cause this. Why? Because pork means there is some kind of infection that is going to come. Infection means Clostridium perfringens can come. Perfringens means it is going to have the beta toxin. Over here, I am talking about Clostridium perfringens and I am talking about the beta toxin. And so theek hai, you'll say, fine ma'am, beta toxin aa gaya. But then, all of us have an enzyme called trypsin, hai na? Trypsin can break beta toxin. What happens is, trypsin has an ability that it can break beta toxin. So we shouldn't have had a problem. Problem happened because we consumed it along with sweet potato. You know what sweet potato has? Sweet potato has trypsin inhibitors. Now there is no trypsin available. No one to break beta toxin. Beta toxin is going to work uninhibited. So this prevents the breakdown of beta toxin in the intestine. Please note. See, if only pork would have been consumed, it wouldn't have caused much of a problem. Pork along with sweet potato ka combination which you call as pig bell. So pig, of course, pork and potato. That is pig bell, right? And although the exact pathogenesis is not very important, but you have that curiosity, so you can learn that, okay, sweet potato has trypsin inhibitors. Trypsin was the one which was going to break this and, this toxin for me. Now, sweet potato is not letting it do that. So how do I treat it? I'm going to give IV penicillin with metronidazole. So please remember, pig bell, you're going to give pig, matlab pork and potato, and you're going to give penicillin. Penicillin and metronidazole is what is said to be the treatment, right? Now, finally, all your clinical features are done. Now I can tell you the lab diagnosis in general. So think of what lab diagnosis will you have, what sample will you take up. For example, gas gangrene ka case hai. So you will take all dead tissues, the muscle which has died, the necrotic element. Of course, that is the specimen that you'll get. Microscopically, we all know Clostridium perfringens is going to show you what kind of spores. Clostridium perfringens is going to show you the, yes guys, it's going to show you subterminal spores. Fine, that will also be noted. What beyond that? You will also be seeing that, chalo, now tell me, gas gangrene is only caused by Clostridium perfringens. Nahi na, it can also be caused by Clostridium septicum. Remember PSN, Clostridium septicum mein kya dikhta hai? You don't have to know a picture, but there's a body called citron body. Dekho, citron has a lot of C's in it. So it is caused by Clostridium septicum. ठीक है, सारे C's वाला thing are gonna come together. Which Clostridium? Clostridium septicum has citron bodies that can be seen. Finally, what is the media? Go back to your culture media chapter. I have taught you any anaerobic organism will always be grown on Robertson's cooked meat broth. Any anaerobic organism is grown on, be it Clostridium perfringens, tetani, so any anaerobic organism is grown on Robertson's cooked meat broth. And I always used to tell you, you used to ask me that, ma'am, perfringens mein kya reaction hota hai, proteolytic or saccharolytic? And I told you my favorite mnemonic of path and micro, P will never be for P. Perfringens is not going to be proteolytic, perfringens is going to be saccharolytic, right? So perfringens is going to be saccharolytic. P is not for P. So remember, perfringens is saccharolytic, and later on when I'll ask you tetani, that will be proteolytic. So perfringens ke sath proteolytic mat rakhna. Perfringens ke sath saccharolytic reaction on a Robertson's cooked meat broth. So specimen done, microscopy done, media done. But abhi to there's a long way of things that are gonna come. Remember, this perfringens is the one which causes gas gangrene. That has a mnemonic called senior NTR. Very famous mnemonic. Senior NTR, so means what? So first I'll tell you the full form. Senior stands for stormy clot formation on litmus milk. Senior stands for stormy clot formation on litmus milk. Let me show you the picture here. Have a look at this. You don't have to know the pathogenesis, but this is a kind of a, you can see this is a litmus milk test, and can you see this very, very famous storminess that has developed over here? Storminess with the clot. So stormy clot formation that has occurred on litmus milk test. That is senior. Now what is N? N stands for the very famous Nagler's reaction. Now this is important because this gets you image-based, theoretical, understanding, subtype ka question. So what is Nagler's reaction? Have a look at this slide over here. Firstly, what do you have? It's a culture plate, and this Nagler plate is famous for what? This Nagler plate has basically egg yolk based agar in it. You know what is egg yolk? Egg yolk is very, very rich in lecithin. Egg yolk has a lot of lecithin. So what I've done, I've divided this culture media into two parts, because over here I'm going to put the sample of the patient. As soon as I put the sample of the patient, sample of Clostridium perfringens, do we all know that Clostridium perfringens has alpha toxin, and I told you alpha toxin has lecithinase property, and that lecithinase is basically now, will it break? Because this has lecithinase property, that is the alpha toxin, and egg yolk has lecithin, so breakage hoga. This will go and start breaking the lecithin, it will go and break the lecithin. That is why what you will get will be an opaque area. So opaque area matlab the toxin is there, alpha toxin is there. I still wanted to confirm it. You know what I did? On the other side, I put antitoxin. कि अगर toxin है and I put antitoxin, it will cancel out. Toxin, antitoxin will cancel out, and that can you see? There is no opacification that is noted. There is no opacification that is noted. So repeating once again, if you get an opaque area, this means the lecithin or the lecithinase, that is alpha toxin, has gone and broken the egg yolk ka lecithin. Reaction has occurred. And if I added something to neutralize it, the reaction has vanished. That is known as the Nagler's reaction. So the question asked is Nagler's reaction is going to use what? So I'll separate these out. S was for stormy clot formation on litmus milk. N is Nagler's reaction. Nagler's reaction is then on egg yolk medium, and it measures what? It is going to measure the alpha toxin or the lecithinase toxin. Coming to the next, T is going to be for target hemolysis. There is something known as target. Target matlab we all know na how dartboard ka target hota hai. So same way, the same picture has been shown over here. It shows you target hemolysis, means double zones are going to be there. Some people call it target hemolysis, some people call it double zone hemolysis. Matlab there is, I'll repeat it for you. There is an inner part of hemolysis, there is an outer part of hemolysis. So remember, the inner part of hemolysis, which is complete hemolysis, is caused by the theta toxin. Inner one is caused by the theta toxin, whereas the outer one, which is incomplete one, which is caused by the alpha toxin. So please remember the inner one. Let's erase this. The inner one is going to be caused by the theta toxin, and the outer one is going to be caused by the alpha toxin. So just remember कि center में वो theta fit हो जाता है, center में ऐसे theta fit हो जाता है. So center one is going to be by theta toxin and the outer one is going to be by alpha toxin. That is the double zone or the target hemolysis. So senior NTR mein what am I left with? There is something known as reverse camp test positive. Okay, so first and foremost, you will, before I tell you reverse, you will have to tell me camp test. Can you tell me that what was the mnemonic which I told you? I told you someone is having a gala time in the camp. Gala time in the camp matlab camp test is by Streptococcus agalacti. Agalacti was for gala time in the camp. And one more organism has a gala time in the camp. Remember that organism who's drunk tulli wala organism, Listeria. Listeria was also having a gala time in the camp, hai na? So that is going to be the camp test. Fine. So now I'm not talking about camp test, I'm talking about reverse camp test. So pehle to you will have to tell me camp mein kya hua tha. Camp mein you'll say, ma'am, the long axis wala line that you had drawn was Staph aureus, and the perpendicular axis was gala, was agalacti, right? You will say that, ma'am, over here also, this agalacti is still like this. Agalacti is still like this. The labeling of this has changed. The labeling of Clostridium perfringens has changed, because right now you told me that perfringens can also have hemolytic properties. Agalacti also has hemolytic properties. So dono ka hemolytic property gets enhanced. There is something known as an arrowhead formation. There is an arrowhead formation that tends to occur at the junction. So what I realized is, whether it is camp test or it is reverse camp test, ये जो long axis वाला, ये जो leta वाला line है, ये जो horizontal line है, that is going to be gala, because gala time means lying down, na? So gala is always going to be lying down. Gala time, agalacti always lying down. Who is standing up is going to change. So in the camp test, it is the aureus that is standing, and reverse camp test is for Clostridium perfringens. So that is the one that is standing over here. I hope that is okay, because that wraps up senior NTR. There is stormy clot formation, Nagler's reaction, target hemolysis, and reverse camp test. Perfectly done. And that means we are done with our story of Clostridium perfringens, because treatment we have anyway done earlier. Sorted, guys. Shall we move on with the next one? And the next one happens to be Clostridium tetani. So of course we know that we have moved towards a disease that is known as tetanus. And we first need to understand, and in simple words, if I tell you, in tetanus, all the muscles have undergone a spasm. Quickly, can you also recall for me, tetanus was subterminal spore, terminal spore, or central? TE means it was terminal spore. And what was the formation? Was it tennis racket? नहीं, TER तो नहीं है, TET है, तो tennis racket नहीं होगा, दूसरा वाला. This was the drumstick appearance that you had. So now why does all of this happen? Because tetanus has two exotoxins, tetnolysin and tetnospasmin. Now they ask you which of them causes tetanus. So common sense, if I'm saying tetanus is all about spasms and muscle spasms, so this is obviously going to be caused by tetnospasmin. Who has the main role in causing spasms? Will of course be tetnospasmin. On the other hand, tetnolysin has no role in the disease. How do I differentiate? देखो, both of them are heat labile, तो differentiate तो नहीं हुआ. Both of them are heat labile. But what is their oxygen ability? So look at this. The way you write, now listen to me, everyone write with me. If you write tetnolysin versus if you write tetnospasmin, there your answer is. Tetnolysin, OL, it is oxygen labile. Tetnospasmin is OS, that is, it is oxygen stable. So see, heat labile to dono hai, but oxygen labile is tetnolysin, oxygen stable is going to be tetnospasmin. And who causes the spasms? Of course, spasmin causes the spasms. Now let's move forward and talk about what does it actually do. So this is just a very, very basic point. Tetnospasmin, I'm just telling you a sentence, don't write this because now I'm going to show you one diagram that will make sense. Tetnospasmin, right now you studied, it is going to affect the spasm, muscle is going to be contracted. So what happens? It acts presynaptically, pehle to rat lo before I tell you the diagram. It acts presynaptically at the inhibitory neuron terminal and prevents the release of GABA and glycine. Everyone, mug it up. Where does it act? Presynaptically. At which neuron? Inhibitory neuron. What does it stop from releasing? GABA and glycine are stopped. So, ठीक है. Now, first let me show you this particular diagram. So, what has happened over here? Where have the spores gone? The spores have gone in the muscle. So, ये रहा हमारा tetanus, which has gone in the muscle after some kind of injury. Okay, after that, what is it going to release? TT. TT matlab what? Tetnolysin, tetnospasmin. What is the worrisome thing for me? It is going to be tetnospasmin, of course. So, it has released TT, that is tetnospasmin. Now, where is it going to go? Is it, of course, from the muscle to the nerve? Matlab it's going backward. It's going in a retrograde manner. We have a retrograde movement that has occurred. And to which neuron is it going? I just now made you ratto also. Which neuron is it going to? It is going to the famous inhibitory neurons. It's going to go till the inhibitory neurons. Now I'm going to zoom into this neuron. I'm going to zoom in. Do you know every neuron has some particles called snare proteins? Matlab, there are some vesicles. Round vesicles I have made na. Iske andar everything is there. GABA is there, glycine is there, all the GABA, glycine, everything is going to be inside this. You will say that, ma'am, you will have to open this. See, this is all GABA, glycine is inside. You will have to open it. So open kaise karte hain? Look at this. So for example, if this is like one high power of that vesicle and this is the membrane. So you will say that, ma'am, they basically, if this is a vesicle and this is the membrane, vesicle will go and fuse, and as a result, everything will be released. So it's occurring by fusion. Can you see? The vesicle is in a way going to fuse and then vomit out. So for example, if this is a vesicle, this wants to give GABA and glycine, it will go, it will fuse and it will vomit out everything. Okay? So how does it fuse? I can see a lot of proteins over here. These are all said to be snare proteins. So there's going to be a snare protein fusion. When there is a snare protein fusion, then everything is vomited out. Snare proteins include SNAP25, syntaxin and synaptobrevin. सब same नाम जैसा है ना. Snare protein includes SNAP, syntaxin, synaptobrevin. So you will say that, ma'am, when all these sin things will fuse, GABA and glycine will come out. But now the problem is that when I'm talking about tetanus, they cleave, they do not let that fusion happen. They are going to say that, hang on, we will go and break this synaptobrevin or VAMP. We will go and break it. Now, when we will break it, how will you fuse and how will you release your GABA and glycine? So, will they allow the release of GABA and glycine? They will not. So, now that vesicle has a lot of GABA and glycine, but that GABA and glycine has remained inside. It was not allowed to come outside, because to come come outside, it needed synaptobrevin. Fusion चाहिए था, वो synaptobrevin was removed. So basically it's like a scissors. I have learned ये जो TT हम कह रहे हैं, the TT from the muscle is going to go in a retrograde manner all the way up till the neuron. This TT is like scissors. What does it go and do? It says रुको, I will go and kill this synaptobrevin of yours. I will go and kill this synaptobrevin. Now when this won't be there, how will this vesicle fuse further? As it is, it will be left. So this is the question that you're gonna get, that what is it gonna do? It is gonna act where? It's acting presynaptically. At which neurons, guys? It is acting at the pre-inhibitory neuron terminals, prevents the release of what? GABA and glycine, and that maintains, na? What do GABA and glycine do in all of us? Relaxation. These people don't have GABA and glycine. So basically there is no relaxation of the muscles that will happen, and that is why the muscles are always in the spasmic state. That is why there is a muscle spasm that has occurred over here. I hope you all have understood the pathogenesis, because now you need to know that the same GABA glycine concept that you have, but if it occurs post-synaptically, it is associated with which poisoning? It is associated with strychnine poisoning. So strychnine poisoning post-synaptically act karta hai, whereas tetanus is gonna act presynaptically. So tetanus is presynaptically, ठीक है? TE pre, that is how we learn it. Tetanus acts presynaptically, whereas strychnine poisoning is going to act postsynaptically. चलो अब हो गया. Now let's come to clinical features, transmission, diagnosis. How does tetanus come to us? We all know there is nothing known as person-to-person tetanus. It is always from some kind of injury, some unsterile, dirty wound, playing in the park, child got hurt, road traffic accident. कोई wound injury story तो has to be there for tetanus to occur. And what is the incubation period, guys? The incubation period is 6 to 10 days, but they say that as the incubation period keeps on getting shorter, this means the disease is going to be worse. And because 6 to 10 days के बीच में average क्या है? 8 days ना? So this is known as the 8th day disease. This is known as the 8th day disease. So on the 8th day, when the incubation period is done, on the 8th day, what is the first symptom that the person will have? Which muscle is going to get affected? There is going to be an increased tone of the masseter muscle that is noted. Because of an increased tone of the masseter muscle, this person will have trismus or locked jaw. There is a jaw lock that is going to occur. There is a jaw lock that is going to occur, and the patient will not be able to open his mouth. So that's the first symptom, problem in the masseter muscle. After that, what are the complications? Ab har cheez spastic hoga. That is how you need to learn. As the disease will progress, you will say that the limbs spasm. Everywhere spasm word will come. Which kind of paralysis? Descending spastic paralysis. Har jagah spasm. The masseter spasm. Limbs spasm. Paralysis, spastic paralysis. What do you think will happen to the reflexes? Deep tendon reflexes. Obviously, they'll get exaggerated. There's exaggerated deep tendon reflexes. But all of this was okay. Jab tak spasm chal raha tha, fine. By the second week, autonomic symptoms also start off. Autonomic disturbances start off, like the blood pressure, the pulse rate, the sweating ability, all of these start happening. That is something which is more worrisome. And please note, the most common cause of death which will eventually happen will be which muscles getting affected? The respiratory tract. So respiratory failure is the most common cause of death. But before death, we all have seen that very, very disturbing picture. Before death, there is definitely going to be a complication. Firstly, you see this over here, where it feels that the patient is smiling, but he's not smiling. Rhizus sardonicus. Rhizus sardonicus. Sardonicus means sarcastic smile. It looks as if this patient is smiling. No, he's not smiling. Basically, his entire muscles have been contracted. Imagine, yahan ka sara muscles, extraocular and all these are getting contracted. So when it gets contracted, it pulls your mouth, and that way it looks he's smiling, but it's actually the muscle contraction over here. He's not smiling. Second, you can see this position over here, the bow wala position. That bow wala position is known as opisthotonus. That is referred to as opisthotonus. So repeating these two things, Rhizus sardonicus and opisthotonus are associated with complications of these. Should we move on to the diagnosis? We all know what is the specimen that we are going to take. Now obviously this is all associated with the muscles and the dead tissue. So we'll take the necrotic tissue. Do I already know if this is a gram positive organism and what kind of spores does it have? We've already studied it. Ke ma'am, isme drumstick appearance hota hai because it has TE for tetni and TE for terminal spores. Do you want to see a picture of that terminal spores? Have a look at this. You can see the next picture, you can zoom into it and appreciate that yes, definitely there are terminal spores, very beautifully visualized terminal spores everywhere. There is no doubt about the same. है ना? ठीक है. Now coming back, what are you gonna see? I can show that picture here only. What are you seeing on a blood agar? You will say that the organism is moving essay. For example, it was over here and it is moving like this. This is concentric movement. Matlab, this is a case of swarming. It shows you swarming on blood agar. It's going to show you swarming on blood agar, and that is important. This concentric is swarming, but there is a long list for swarming which I will be giving you in the next chapter. Moving on, what does it show on gelatin stab? Abhi pehle to tell me, where did you study gelatin stab? I had studied that in a case of Bacillus anthracis, because I had said that Bacillus anthracis hai aerobic. Bacillus anthracis is an aerobic organism. It will work in gelatin maximally on the surface. So in Bacillus anthracis, I was seeing maximum activity here and least activity here. We had seen inverted fir tree appearance क्योंकि वो aerobic था. It was working more on the surface. Clostridium, on the other hand, is anaerobic. Means Clostridium tetani, for example, if this is the gelatin stab, anaerobic organism means it will work maximally at the bottom where there is no oxygen. It will work maximally over here and it will hardly work on the tip where there is oxygen. So this kind of an appearance becomes a fir tree. So simple, it's based on the aerobic anaerobic ability. Bacillus is aerobic, works on the surface, so inverted fir tree. Tetanus is going to be anaerobic, it works at the bottom, that is going to be fir tree. Exam में इतना logic लगाने का you don't have time. So remember, tetani tree, सीधा tree, ठीक है? Tetani is simple tree. So simple tree always looks like this. Whereas when I'm talking about Bacillus anthracis is going to be opposite tree, inverted tree. Tetani, सीधा tree. Finally, any anaerobic organism is going to be grown in a yes, Robertson's cooked meat broth. So what are you going to see? You're going to see a black color, because I told you that this will show you a proteolytic reaction. I hope you all remember, guys, that I gave you a mnemonic. P is not for P. So repeating that once again, if you are getting confused between Clostridium perfringens and Clostridium tetani, which is saccharolytic, which is proteolytic, so you can't keep the P over here. No, you will have to keep the P over here in tetani, that is proteolytic, whereas what is saccharolytic? Saccharolytic is going to be Clostridium perfringens. Sorted? Now, I'll show you the pictures once again. Have a look at this, guys. Have a look at this Robertson's cooked meat broth, and in this Robertson's cooked meat broth, you can see a black color has occurred. Black color is actually indicative of a proteolytic reaction, right? So simple. You can see the drumstick appearance, Robertson's cooked meat broth, swarming ability, all of that is done. But one bookish knowledge is known as what is Fildes technique. So Fildes technique or Fildes technique, whatever you want to call it. And Fildes technique basically says, if I want very pure colonies of Clostridium tetani, I've used this. So just have a ratta that you'll have to do. Fildes technique is when you want very pure colonies. So what you're going to do is, you are going to actually take a test tube like this with a nutrient broth. So for example, you have taken a test tube like this and that is taken with a nutrient broth. You will realize that if you try to grow it at the bottom, so for example, you kept your sample at the bottom. If Clostridium tetani has grown, have I shown you that it shows you swarming motility and it will come up on the surface? Will you be able to isolate pure colonies from the surface? Yes, we will be able to isolate pure colonies on the surface that will come up because they will swarm, they will move. That is what happens. So that is what is Fildes technique. This was only for your understanding. No one will ask you the process of Fildes technique. But yaad rakhna hai, Fildes technique is for pure colonies of Clostridium tetani. Finally, before I end tetanus part, you obviously all have to know that how are you going to do the prevention, whether a person comes to you with simple wound or other complicated wound. Simple wound matlab if it's a clean wound and the duration of the wound has been less than 8 hours. Complicated other wound matlab if there's a dirty wound and the duration has been over 8 hours. Right? That is the definition of simple complex. Simple is clean, other one is dirty. Simple is under 8 hours, other one is over 8 hours. Then we have category A, B, C, D, means if the person says that I have had a tetanus toxoid or a booster in the last 5 years. The other one says 5 to 10 years. Third category says I had it beyond 10 years ago, and the fourth category is the most common that you'll find in our country, who will say pata hi nahi what injection I had got. So repeating, within 5 years, 5 to 10, above 10, and I don't know, the Dumbo people who have no idea what has happened in their life, whether they ever got any injection or not. So now what do? whether if a person has received a booster or a TT in 5 years, irrespective of whether it is a simple or a complex wound, you basically have to do nothing. ठीक है? However, if there is 5 to 10 years, category B में है, if it is a simple wound, you give 1 tetanus toxoid का dose. If it is a complicated wound or other wound, you give 1 tetanus toxoid का dose. So that is if the person is falling under the 5 to 10 years. Beyond 10 years में क्या करोगे? Simple wound, again 1 tetanus toxoid. And if it is above that, if it is complicated, you will have to add immunoglobulin. You will have to add immunoglobulin over here. That is, finally, I will say, that is how I have learnt it. So simple and pehle mein nothing. Then you are going to make an L like this and you will say that दूसरे वाले में भी 1 dose, third वाले में, simple वाले में 1 dose, other में I will have to add immunoglobulin. Fourth wale, the Dumbo person, you cannot do with 1 dose, you will have to give him the complete toxoid dose if it is a simple wound, and in a complicated wound, along with that complete toxoid, you will have to give him human tetanus immunoglobulin. तो कैसे याद करें? Now simple. First, figure out that पहली category में तो दोनों ways में कुछ नहीं करना. Second category में दोनों ways में 1 dose you are gonna give. The third and fourth category, if they are simple, you are gonna give simple. Third category है तो 1 dose and fourth category है तो complete dosage. Whereas उनके complicated वालों में you are gonna give immunoglobulin. I hope that's okay. So category A, B, C, D. Maybe you can give me a very quick overview of this once again. Ready for it? So what do you do? If it is category A, simple, and whether simple or complex, ma'am, I will do nothing. Okay, category B, bus 1 dose I will give in whether it is a simple wound or whether it is any other wound. Beyond 10 years, simple wound में तो I will still give 1 dose, वो L बनाना था. And if it is category B, then simple wound में I will have to give complete dosage. But इनके साथ I will add on the immunoglobulin in their other wound वाला category for category 3 and 4. I hope this is okay because this will also help you in your pediatrics and so many other places. Clostridium tetani done. We move on to the most toxic substance that is known to be lethal to mankind, and that is Clostridium botulinum. Before I start, what is the mnemonic out here? Clostridium botulinum is bottled and canned food. That is how I have learnt it. Clostridium botulinum is going to be bottled and canned foods. That is one very important point that you will see over here. So before I get to that, so you've understood bottled and canned food matlab ma'am kuch to intestine ka problem it is going to cause, but it's also going to cause a brain problem. So first I'm going to show you a list which is a little scary. We call this botulinum toxin. Of course it's botulinum toxin, but it's got a lot of serotypes. I have A, B, C1, C2, D, E, F, G, and earlier there used to be H, but now they say H nahi hai. Now it is a hybrid of F and A. So theek hai. They keep changing these terminologies. A, B, C1, C2, D, E, F, G and F, A hybrid. Out of which humans में botulism कौन कराता है? Abe is gonna cause humans में, तो Abe it is gonna cause infections in humans. ठीक है? तो A, B and E are gonna cause infections in humans. पहला mnemonic हो गया. Next. Please note that A out of these, Abe ka A is going to be the most severe that is known to us. Then note all of them are going to be, they are all mediated by chromosomes. It is only C1, C2, D, या CCD. CCD is going to be Phage coded. So remember this CCD over here, इसके अंदर क्या है? CCD तो anyway mnemonic है, cafe coffee day. CCD is going to be Phage coded. And all the others are gonna be chromosomally coded. Now the real word is that which of them will affect the intestine and which of them will affect the brain. So all of them are neurotoxins. Sub neurotoxins hai. Only this C2 is an enterotoxin. This is the one which is gonna go and affect the intestine. So remember the C2 is gonna be colon wala C na, so C2 is gonna be colon wala enterotoxin, rest all of them are neurotoxins. Do you want to do a quick recap? Tell me which are the ones which cause infection in us. Abe causes infection in us, ABE, which is A is most severe. Okay. After that, all of them are chromosomally mediated, but CCD is gonna be Phage coded. All of them are going to be neurotoxins, but a colon wala C2, that is going to be enterotoxin. So now we can go ahead and study that what is going to be the exact pathogenesis out here. So please note, again, this is, I'll show you that diagram. You'll say, Arey ma'am, again you have shown this diagram to me. Rather than showing you written stuff, we will see diagram. Same diagram aa gaya. Because now guys, you need to analyze. Pehle kya kara tha? Where did we study this mechanism sometime back? The same diagram I showed you for Clostridium tetani. But which neurons were shown over there? I was showing you the inhibitory nerve terminals. Because the inhibitory nerve terminals had molecules like GABA and glycine. They had GABA and glycine. Now I'm not showing you those. Now I'm showing you the activating nerve terminals. If you want to see the same diagram once again, now I'm going to take you towards these, the excitatory neurons. Now I'm saying the problem is going to occur over here, but the concept is the same. This also has those vesicles. This also has the snare proteins, the SNAP25, synaptobrevin, syntaxin, सब कुछ same है. The only difference is that these are excitatory neurons, so they won't have GABA glycine. Excitatory matlab they will have acetylcholine. So now the only change in the story that has occurred is that the same problem is going to occur. This botulinum toxin is now going to come and cut off synaptobrevin, SNAP25, syntaxin, all of these are going to be cut off and there is no fusion. So what is now going to be released? Acetylcholine is not released. Guys, when I say acetylcholine is not released, means there is no contraction. This means there is no contraction of the muscles. The muscles are gonna look very, very floppy. The muscles are gonna look very, very loose and very, very floppy. So I hope everyone's understood. I'll quickly revise it for you. See guys, when I'm talking about this diagram over here, this is such a nice diagram. I say if there is a problem in the inhibitory neurons, jahan se GABA glycine had to come, then it's tetanus. If there's a problem in the excitatory neurons where acetylcholine had to come, there is botulism. So when GABA and glycine did not come, everything was spastic. No one to relax. Everything was spastic. Spasms हुआ tetanus में. Over here, acetylcholine will not come. So no one to contract. Everything is going to be loose and flaccid. So that is going to be resulting in what? That is going to result in floppy, means there will be flaccidity that will be noted. Everything is going to be flaccid. So how does one get, this is the mechanism, how does one get botulism? Please note, there is something called food-borne botulism, which food se hoga, and I've already told you which kind of food. You will always remember bottled and canned food. In fact, I'll give you one very day-to-day life wala important point. So many of us, especially people who are studying in foreign countries, we are very much reliable on canned food on bad days when we don't have any food to cook. So canned food mein expiry to we always check, but sometimes if you open the canned food and if it is smelling and it has bubbles on its surface, even if it is within expiry, if it's within its date of expiry, it's not expired, but if you see bubbles after opening it, never consume it, because that is a very high indication of botulinum infection. So food-borne botulism matlab bottled and canned food se hoga. Similarly, this can occur via wounds, this can occur via surgeries, and this can occur in infants. Why will it occur in infants? Don't we always keep on, as an intern, as a doctor, don't we always keep on telling people that when your kid is born, please don't make him lick honey, or please don't give him any artificial food items, or do not. Many people have those rituals where they'll come in the hospital with a jar of honey and they will say, we want to make our kid lick honey. So please remember, all these kind of things happen with honey, baby food and bottle feed. This is what is going to happen. Infant botulism can happen. So let's go one by one. Pehle, actually my main concern is going to be between foodborne and infant. In pe question aata hai. So foodborne botulism means there is going to be bottled and canned food that is going to be very, very troublesome. And these are going to be heat labile toxins that we have. Also, the incubation period is very, very short. It is only 12 to 36 hours. So it's not much time after you consume the food. What is it going to result in? It is going to result in all the D's. So now start thinking of all the D's in the body. Patient is going to have diplopia. There is dysphagia, dysarthria, descending flaccid paralysis and dilated pupil. What did I say? Everything is going to be flaccid because botulinum by definition is going to be flaccid. So this means there is descending flaccid. I hope you all remember tetanus. Tetanus mein there was descending spastic paralysis, whereas botulism is going to be descending flaccid paralysis. Now I know in the exam मतलब ये सबको पता है, but कई बार होता है tension. तो जब exam में what happens when you are tensed? Tension में क्या होता है? Tension में you're like you close your eyes, you clench your face. Tension में you're like अरे please याद आ जाए. That kind of a reaction you have, है ना? तो tension में everything is undergoing spasm. Right? And the other one becomes flaccid. So tetanus is about muscle spasms and botulism is about flaccid. And you have diplopia, then you have dysphagia, dysarthria, descending flaccid paralysis and dilated pupil. That is about your foodborne. Matlab along with this, of course, you are gonna have GI symptoms also. Foodborne hai, to GI symptoms to of course honge. Because that is how I used to differentiate it from wound botulism. Wound botulism firstly has a higher incubation period. All the TDDD can occur, but GI symptoms are not gonna be there. GI symptoms nahi honge. Why? Because the third one, that is infant botulism, which I just told you is again by kuch khane peene se hua, like infant has been given bottle feed, honey, baby food. This has an incubation period again, which is very short, 1 to 2 days. So can I say anything that is going via food? Whether adult mein foodborne tha, that was also 1.5 day incubation period. This is also 1.5 day because this is also going via food. In that also GI symptoms were seen. In this also, the first symptom that the child is gonna have is constipation. So that is why it's so important to pick up GI symptoms now, because please note that GI symptoms are there whenever a food is consumed or whenever an infant is going to consume some food, but GI symptoms will never be there in case of any wound or surgery that has been done. So it's very important to see whether GI symptoms are accompanying or not accompanying. So coming back, when you're talking about infant botulism, you know, it has happened kuch galat khana peena, 1.5 day incubation period. First symptom is constipation, and then the child is going to become floppy because everything will be flaccid. So what do you call it? This is known as the floppy baby syndrome, because all the muscles are going to become flaccid over here, right? Finally, you know what is the lab diagnosis? There is nothing for me to tell you, honestly, because you guys know it is a gram-positive bacillus. You know it is a spore forming and most common location is subterminal. You know कि ये clostridium है, तो clostridium में तो B can come, so these are bulging spores. You already know clostridiums are anaerobic. Nothing that I have to tell you. Treatment, obviously all of it has been caused by botulinum toxin. So the treatment is going to be antitoxoid. You are going to give antitoxoid for the treatment of botulinum toxin. Sorted? This is also done. Now we are left with just one last clostridium, and that is Clostridium difficile. Which infection is coming to your mind? Because Clostridium difficile is normally also present in our gut. Infection coming to our mind is pseudomembranous enterocolitis. Pseudomembranous enterocolitis, written as PMEC. Enterocolitis, I have understood this is going to happen somewhere in the intestine. Pseudomembrane will be formed, and I will see that. So देखो, virulence factors, it has toxin A, toxin B. I want all of you to, abhi tak whenever I used to study AB na, I used to say A is for action, B is for binding. Because I used to say it's one toxin. Like for example, I'll say diphtheria hai, so diphtheria mein one toxin is there that has a fragment A and that only has a fragment B. I'm not saying that over here. I'm not saying it is one toxin with fragment A, fragment B. No, I'm saying there are two different toxins. There is toxin A, toxin B. So don't use that AB wala mnemonic here. Toxin A is an enterotoxin which is going to go and attach intestine se attach karega. Toxin B is going to kill the cell, cytotoxin. So one is an enterotoxin, one is going to be a cytotoxin. So what is the mechanism of Clostridium difficile? Let us all draw one really big 2-3 cells for us so that we can easily identify what is happening in the intestinal cells. Now I'm not drawing too many to save space. We have toxin A and toxin B which have come into the system. As soon as toxin A and toxin B will come into these cells, you know what they are going to do? They are going to go and attack the GTP binding proteins. They glucosylate the GTP binding proteins. What are the GTP binding proteins? If you can learn the names, otherwise even if you learn GTP binding protein is good enough. And that includes the Rho, it includes RAC, and it includes CDC42, right? So these are the GTP binding proteins. It will go and glucosylate it. You know, as soon as glucosylation occurs, what happens? The actin cytoskeleton is damaged. That is the effect that it's going to have. There is going to be a damage to the actin cytoskeleton. Actin, as you can see, is very, very important to maintain the integrity of the cell. Now I'm saying the active cytoskeleton has basically gotten damaged, and this is then going to result in cell death. This is then going to result in apoptosis or cell death. That is one thing. Also, please note that along with this, they are going to also stimulate. They are also going to stimulate interleukin-8 production. Guys, interleukin-8 production, matlab who is going to get recruited? Interleukin-8 attracts what? You studied this in pathology. It attracts the neutrophils. There is neutrophil recruitment that is going to occur, and that is also what you see. So, sabse pehle you will be seeing a lot of dead cells because the cells are dying, and secondly you will be seeing a lot of neutrophils. And you know, altogether this is the thing that has ended up making that very, very famous membrane. Why are you calling it pseudomembranous enterocolitis? Because there's a membrane that is formed. Can you see this dirty yellow necrotic membrane? Yes. So this dirty yellow necrotic membrane that you are dealing with, this is the one that is responsible. Why? It has formed because of that full pathogenesis of difficile toxin that I have taught you. As a result of which, this dirty yellow necrotic membrane is present on which side? This is a question. It is present on the mucosa, under, because everything is happening inside. Na? It's present on the inside part. Outside part pe nahi hota intestine ke. It's on the inside part. Why? Because you were saying that all the cells are dying. And that is why those dead cells are going to burst out like a lava. They say there is a volcano eruption that is noted in pseudomembranous enterocolitis. So remember, pseudomembranous shows a pseudomembrane on which part? Dirty membrane on the mucosal part. And what does it show microscopically? It shows you the volcano-like eruption. So are we ready for the disease now? Now that the pathogenesis is done, what is pseudomembranous enterocolitis? Who is going to get it and how are they going to show up? Someone who has been on a long-term usage of antibiotics. Long-term usage of antibiotics. Just to give you an example, very commonly these antibiotics are third generation cephalosporins. Third generation cephalosporins ka usage will be said that a person was prescribed cephalosporins. He continued eating it for 2-3 months without a doctor's prescription. As a result of which he landed up with watery diarrhea. Most commonly there is watery diarrhea. You will say that okay, because of this long-term usage of antibiotics, his gut flora got altered. He got infected with Clostridium difficile. Watery diarrhea hua, and that is what he has come up to me with. So now tell me, how are you going to do the diagnosis? Some things are common sense. Sabse pehle you will say that, ma'am, I will do colonoscopy. I will try to look at the intestine. It's very, very specific, of course, because in the intestine, if you can do a colonoscopy and see the membrane, there is nothing better than that. There is obviously going to be a specificity, but that means that if present, it is definitely Clostridium difficile. But it is not seen in many of the cases. So its sensitivity is very low. But if present, it is 100% specific, but is not seen. So sensitivity low hai. What can you do next? You can obviously, the point is you will have to find out the toxin. How will you find the toxin? Lots of methods to find the toxin, which I'm going to come to. You can do a toxin tissue culture assay. You can culture it. So you can do whatever membrane is there. You will do tissue culture assay. You can use ELISA. Okay. After that, you can grow it on media, culture media. What culture media? CCFA, CCYA. First and foremost, please remember Clostridium difficile. Clostridium difficile, because it has a lot of C's, so that is going to be CCFA, CCYA. So cefoxitin, cycloserine, fructose agar, cefoxitin, cysteine, yeast extract agar. So CCFA, CCYA seems to be a better option. So इनमें CC वाले media आएंगे. Apart from that, can you do a histopath? Of course, I have told you, it shows you that famous volcano-like eruption. Finally, can you also go in for a PCR for testing the toxins? Of course. So toxins can be measured by tissue culture assay, which is one of the best methods, that you grow it on a culture media and then you look at the toxins. You can do an ELISA, you can do a PCR for the same, and yes, that is definitely going to be the diagnosis, which makes me go to the treatment. Now, there are so many updates that have happened in the treatment. That is why, as it is, whatever has been written as an update, I have got it to you as it is so that you can give this as a reference. That ye latest CDC guidelines hai, ye latest Harrison guidelines hai. So earlier they used to say oral vancomycin, but what is the newer drug that has come up? The newer drug that has come up is fidaxomicin. Firstly, that is the update. The treatment is going to be fidaxomicin. Yes, it may or may not be accompanied by oral vancomycin. Okay. Now they were always also saying that what will you do in cases of severe or fulminant Clostridium difficile infection? CDI matlab Clostridium difficile infection. So fulminant matlab when there is severe ileus, exact same line I've got for you. It is severe cases mein hum oral vancomycin hi denge. Fidaxomicin is coming across more for the early cases. Okay? So severe cases mein we are going to give oral vancomycin along with conjunction with IV metronidazole, and if needed even beyond that, we might want to give rectal vancomycin enemas also. So oral vancomycin to hoga. If need arises, we might have to give rectal vancomycin also, and along with that, we are going to give IV metronidazole. Basically, every route of the body has been accompanied. Oral, so vancomycin. Rectum, vancomycin. IV metronidazole, because severe infection hai na, that's severe or fulminant CDI that is there. But yeah, if they say the first, now the latest drug that has come up, fidaxomicin for early cases, but for severe cases, as I said, oral vancomycin is still the drug. And yes, with a sigh of relief, our Clostridium chapter comes to an end. Ready for some questions? Gas gangrene is caused by all except, I remember gas gangrene was caused by PSN, perfringens septicum and novi, perfringens septicum novi. Anyway, everyone would know tetanus doesn't cause gas gangrene. Tetanus causes tetanus, common sense. Next question. Naegler's reaction is predominantly associated with which toxin of Clostridium perfringens? So Naegler's was to do with that lecithinase. Yes, I can see lecithinase in the options. Which toxin? That was the alpha toxin. Coming to the next question. Which of the following is incorrect about the toxin leading to the disease? Is it heat labile? So, pehle to toxin batao. What disease is it? I can see a patient with Rhesus sardonicus, and this means it is caused by tetanospasmin, right? Lots of spasm. So, tell me, is it oxygen stable? Yes. Every toxin is heat labile, whether tetanolysin or tetanospasmin. Heat labile sab the, oxygen yes stable tha, that is correct. Does it inhibit the release of GABA and glycine? Correct. But does it act post-synaptically? No, I had studied that tetanus mein T aata hai, so that is going to act pre, that is T is going to act pre, so pre-synaptically act karega, that is what was important. Coming to the last question. Hospitalized patient means a patient who's probably been having a lot of antibiotics, developed severe watery diarrhea and dehydration after a long-term course of antibiotics. Long-term course of antibiotics with severe diarrhea, I start thinking of pseudomembranous enterocolitis, Clostridium difficile infection. The histopath image is also showing me the classical volcano eruption. Which of the following toxins are responsible for the production of this condition? You know, Clostridium difficile has two toxins, that is toxin A, toxin B, and they are the ones which are responsible for this condition over here. Now, on that note, you will always see lots of confusing questions in your previous year on Clostridium difficile and its toxins. What is the best test? What is sensitive? Let me tell you, in today's date, there is no single test that you're doing for the sensitivity, specificity. You are doing a combination of tests, colonoscopy with toxin, by tissue culture assay, by ELISA. So, there's no one single test on which you're relying completely for the diagnosis of Clostridium difficile. Thank you so much for listening to this pore forming lecture.